Good morning, Pagosa, and thank you to RG Bank. We are here today with Dr. Rhonda Webb and CEO, Dr. Rhonda Webb, who is the CEO, and Jodi Scarpa, who is the Manager of Community Relations for Pagosa Springs Medical Center. How are you guys doing this morning?
Hey, Jeremy, I'm doing great. How are you?
Doing great, too. It's a beautiful morning. Lots of excitement through town, as we know.
Yes, lots of folks here from out of town, and happy to have everybody here trying to support our local businesses, especially those downtown. The road construction's a little to deal with, but, overall, there's no reason to avoid downtown area. You might have 5 minutes longer to wait for somebody to turn left, and I've been amazed at how many people stop and let you come out.
It really is nice. That a police officer did that with us the other day, and I was like, well, if he's letting us do it, then I think this is the right way to go.
Agreed. And
it's wonderful, too, to have everyone, get out of their car and actually stretch their legs and walk through town now.
Yeah, there's plenty of places to park.
Extra steps.
Yep.
I'll take them.
The way to wellness, for sure.
Yes. Well, what brings you guys in this morning?
Well, we're here to talk about all the latest and greatest things that are happening at Pagosa Springs Medical Center. I think I'll start by saying in primary care, we've had a lot of turnover lately, and that's a fact.
Sure.
We actually have less turnover than the national average in primary care, and we were very stable staff-wise last year. And then suddenly this year, we've had several people leave, mostly for personal reasons.
Sure.
One longstanding doctor here wanted to take an adventure and move his family up to Alaska, and so they've done that. He's much missed. We are recruiting every day. I talk to new physicians, and there are people that want to be here, and we're just taking our time finding just the right person. We did just hire a new physician assistant whose parents live here. He's from Colorado Springs, very experienced. His name is Josh Pasley, and he and his wife, like I said, they have family here. But it takes a little while to get these things going. In the interim, and Jodi, you know this, that our existing primary care providers have opened up their schedules to get more patients
Excellent.
in. Some people have added days to their week, and so we really, everybody's kind of just pulling in there trying to get patients seen. So bear with us. If you've got a problem getting in somewhere, never hesitate to reach out and ask.
Sure.
About an appointment.
Yeah.
Well, that's really good information, and I'm sure with obviously if there's any emergencies, still call 911.
Right. We're one of 6 hospitals in the state of Colorado that own the ambulance services, and most people don't do that because, sorry, EMS guys on here, but ambulance loses money. So hospitals stopped owning those in the 90s.
Sure.
But we have amazing first responders all over, but starting dispatch forward to everybody, but amazing people at EMS. And so always, if there's a question, dial 911. We have an ambulance staged on the east end of town during the construction times to make certain that it speeds up our response as best we can. Ultimately, of course, our goal has always been to say yes to EMS and get us station on the east end of town, but we have to wait for those things to happen.
It's all a work in progress, and you guys are clearly putting in a lot of work at the hospital as it is.
Yeah, Jodi just did our annual gala, our fundraiser, thanks to the Alley House Grill and many other people who helped us with that. RG Bank, Evelyn Tennyson, England Volkers, Happy Trails, thank you, Maria, Visiting Angels, City Market, Radiology Imaging Associates, Nunn Construction, USI Insurance, and Novo Benefits, Agile Construction. They were our sponsors for the year, and then it always culminates in an incredible event, and once again, it was quite successful, Jodi.
It was a lot of fun, and it's so validating to have that kind of support on that evening and have all of our friends there celebrating together.
Yeah. It was
really grateful to everyone.
That is something that makes this town very special. It really is a community, more than most places that I've lived.
Right. I would agree 100%. People all get in there together and try to support one another, and when somebody's down, the next person's up, and they pull them forward, which is an amazing thing about Pagosa.
It is. And then, if there's something that we need here and it doesn't exist yet, well, we're going to build it.
That's right. There is that.
And we do that at the medical center all the time.
Right.
Certainly. It seems like you guys have had a ton of renovations and a ton of improvements all throughout.
So, yes, over this past fall and winter, we did remodel the building on our corner that used to be Dr. Pruitt's office. It's lovely. We call it our medical wellness building. It's got a wellness classroom in it. It's going to house physical therapy and occupational therapy, in addition to other service lines, maybe even some integrated and behavioral health there. We'll see. We are waiting for Medicare. Medicare is who we depend upon to give us our final go for it on the fire inspection. So I think they're coming Monday, so it looks like we might actually be in that building next week.
That is amazing.
Cannot wait.
That's a long time coming. I'm happy for you guys.
It is a long time coming. We can control what we can control. We cannot control everything. And so Medicare is one of those guys that we appreciate very much, but they decide. And we don't get to tell them what to do.
Yes, we're on their time.
Yes, we are on their time.
And as a spoiler, once we get that go-ahead, Rhonda, what are we going to do?
We're going to do a big open house at the hospital, including having that building open. And people who have been in there in the past need come out and take a look at that. We'll do something one evening, probably on a Thursday. That's our usual kind of open house day, and have all of our facilities open. You want to take a look at the new robot, we'll have it available, for the orthopedic robot.
Yeah.
You can get into surgery. You can kind of just do a little bit of everything. Everybody, all hands on deck, and we will have that new building open too.
It'll be
we're excited about
very
that.
fun, yes.
Yeah.
Yeah, that was something I was looking at, actually, was, one, how much you guys have moved towards the technology, or improved technology. I know you guys do telehealth, but then, like you just mentioned, the assisted robotic surgery.
I know.
That is fascinating.
So, Jeremy, you probably don't know this. My husband drugged me here kicking and screaming in 2014 we started. The hospital had recruited him, found out we had a house here, and we came out kicking and screaming because I'm a somewhat nerdy nephrologist. I was a kidney specialist, and we don't like change. And so we came out and started orthopedics here. And it was really good for the hospital, good for the community. And then last fall, on September the 16th, my husband's new partner started. Dr. Jeremiah Steed is from Pagosa.
Yes.
Moved back here with his wife and 4 children. And he is, of course, the future of orthopedics here. And he's Mako trained, which is the orthopedic robot. My husband's been kind of doing this for 40 years, so he's not going to go back and learn how to operate on a robot.
No, he's almost robotic in himself with the muscle memory, I'm sure.
That's right.
He still does like to operate. But Dr. Steed is here for the future, and we just couldn't be happier about that. It's been an amazing transition, so we're grateful.
That's extremely exciting. I know multiple people in town, for better or worse, that have seen your husband. And
He's a popular guy.
He is a popular
Sure.
guy.
It ends up being for the better. Maybe not
right.
at the start.
Right.
We have another new thing happening in that we lost our cardiologist who retired after 8 years with us, Dr. Lambert, last year. And we were unsuccessful in recruiting a cardiologist to this area, but people want a cardiologist. So now we have entered into an agreement with Common Spirit Health, which is Mercy over in Durango.
Yes.
And they will have a cardiologist in our clinic it'll ultimately be once a week. I think it's going to start out every other week.
Sure.
And it starts in September. The credentialing process takes a while. Once that's all done, we're very excited about that.
Yeah, that's excellent, especially since people are looking for that, and to, even have something at a part-time scale is going to make a huge improvement.
That's right. It keeps you from having to drive to Durango, which gets to be kind of a burden after a while. The more things we can have here, the better. And it really complements our full-time pulmonologist, our lung specialist.
Yes.
Yeah, they'll be working a lot together on people with disease. Needless to say, we have altitude. A lot of people have lung disease or cardiac disease, and so we want to help whenever we can with that.
Yeah, definitely. That's just with many businesses around. I'm sure the hospital, probably add 100 times more difficult to get someone to come in, a specialist to come in.
It's amazing how that works. A lot of times we get doctors who just drive through here on the way somewhere, and then they stop in and say, "Hey, you got any openings?" That just didn't happen in cardiology,
Sure.
so we reached out ourselves. But there's of course a shortage of healthcare providers of all rank.
Certainly.
Especially since the pandemic, a lot of people took kind of an early retirement or went into something besides healthcare. It was a challenging time for everybody in our nation, in our world,
Yes.
but especially challenging, I think, for healthcare workforce.
I consider 2020 year 0, and now we're at year 5. So we're still in the early stages of recovering from everything.
Yeah, and it's so hard on people. I mean, we feel that for sure at the hospital. We're still short-staffed in a lot of areas, but in oncology, our cancer program goes forward. We have a new oncologist starting, Dr. Sammy Diab. Dr. Jordan is still working, and he's been fabulous. He started the cancer program in 2018.
Yes.
But Dr. Sammy Diab is coming to us from St. Joe's in Denver. He's been practicing since 1994, and he also did an integrative medicine program at the University of Arizona, Andrew Wiles program, Dr. Andrew Wiles. So we're excited to have that going forward. He wants to bring some research here and just bring us right forward, and we're excited.
That's excellent. Truly, you guys are never stopping. You're always improving and always getting bigger, always expanding.
We are.
And recruiting.
And
right?
recruiting.
And recruiting, that's a big thing.
Rhonda, sometimes people ask me why it takes so long once we decide to hire someone to get them on board, and that has to do with the credentialing. And could you describe that?
Oh, sure. Ooh, I wish Krista was here to give us
Yeah,
all
no,
the
I was
details.
saying-
But the medical staff is responsible for making certain that we are hiring the right people, and that takes a while.
Yes.
And then the payers, of course, take a while because they have to go through their process, which is in their court. So we get all the paperwork ready. We do the background check. We do all those things. The provider who's coming on board, whether it be an advanced practice provider or a physician, they submit their applications, but then it has to go through our medical staff to look through all the background, all the education. They look through everything, and then ultimately they present that to the board of directors. We are governed by a 7-member publicly elected board, and that they're the final check on who comes on board. So that does take a while, a couple of months
Certainly.
at least, maybe even 3 in some
Yes.
instances. But we have a great medical staff, and so both our physicians and our nurse practitioners and our
Physicians, assistants, yeah.
Gosh, it's early.
It is early. We're doing it, Rhonda.
Yeah, we're in this together.
Yes.
That's right. I'm not much of a morning person.
You're doing great. And something you don't know, Jeremy, not many people do know. We have our CEO is a physician. Rhonda's a nephrologist also, but she's also the chief medical officer, which means she. Well, you can talk about that, but she interviews every physician and advanced practice provider that comes into the medical center. So that is a separate job. She has 2 jobs.
2 full-time jobs.
Two jobs. But we've been getting it done, and I tell people all the time I have the best job in the world because I get to lead an amazing team of people. Our employees are fabulous. They, for the most part, seem to want to be there. They want to help our community, and I just get to walk around like the Walmart greeter and tell them thanks and take credit for all their hard work.
Well, I was going to say, you put in a lot of hard work to get them there. So
Yeah, I was going to beg to differ on that one.
Well, it's fun. It's fun. Another thing that's fun. Am I getting to time?
you can talk about this, and then we'll take a quick commercial break, and then we can
Okay.
come right back.
Okay. So we did start our oxygen generation project last week. It was a few years in the making. We realized before the pandemic in 2019, we had a tabletop with a lot of the area public service and some laymen from the public, and realized that if there was a big event here, if all roads out were closed, there was a fire, there was
snow,
Yeah.
whatever, then we would run out of oxygen because it was coming in via delivery. So during that time in 2020, we did have oxygen. We had to calculate our oxygen use fairly closely during
Sure.
the pandemic, early days. And so we then bought the equipment with the help of COVID dollars, actually.
Right,
It was
grants.
stored for a while until we could afford to build the very expensive specialized building, and we went live with generating our own oxygen. And very few hospitals in the United States generate their own as a primary source of oxygen. We have backup tanks, but we
Sure.
are primarily generating our own. So that
Wow.
was a big project, and kudos to the team that led that, especially
amazing.
Chief Jason Webb from EMS and
Yes.
David Ball, head of IT and facilities. But it was just a lot of work on a lot of people. It went very well. So
That is so impressive, just to make yourself even more self-sustaining.
and thanks to the state of Colorado, who did do grant money for us, and the
Department of
governor,
Local Affairs.
yeah, Department of Local Affairs, and
So,
the state,
HICPUF, yeah.
HICPUF, the governor. Anyway, it was all very, very exciting.
Yeah, and it takes a lot of pieces coming together to make
Right.
this a full picture.
Right.
Well, with that, we'll take a quick commercial break, and we'll check out the River Report, and we'll be right back. All right, sorry about that. We will check in with the Western Daybreak in just a little bit. We are back with Dr. Rhonda Webb, the CEO of Pagosa Springs Medical Center, and Jodi Scarpa, the Manager of Community Relations and the Foundation for Pagosa Medical Center.
Well, here we are back. So I always like to remind people that rural hospitals run very tight margins. Of course, right now we're watching what's happening at the state and federal level with our funding. We spend $124,000 a day. So we have the same rules and regulations that the big hospitals have. So again, margins are tight, but we continue to do some things. We're going to remodel our emergency department for some safety and efficiency. And we're coming up with a big sterile processing upgrade, which is sterile processing is what you do back in surgery to clean instruments and all that. Our infection rate is quite low, but the state has made a bunch of changes, so we are going to proceed with those projects in the fall. And now I'm going to turn it over to Jodi to talk about Tough Enough to Wear Pink.
We are excited. This is our third year to collaborate with Archuleta County Fair to host the Tough Enough to Wear Pink rodeo. And it will be Friday, August 1st. The fair starts on July 31st, Thursday, and it'll be at the Archuleta County Fairgrounds. We will have broncs and bulls and Bayfield bells and a survivor ride. We're very excited this year that we're going to have a first responder stick horse race. And I don't know if you've been to this rodeo, Jeremy, but we have a children's stick horse race, and those stick horses are actually blow up pink ponies. And it is the most fun thing to watch.
It is hilarious.
Aren't they the
They're so cute. And I'm sure the first responders will be really cute too, but the kids are really great.
Well, it's confirmed we have our PSMC EMS challenging the Archuleta County Sheriff's Department. And I don't know if you know that Mike LaRue is a very fit sheriff. And so we are, and I'm calling it out now, we are planning on how to beat them however we can in the stick horse race, including
Without using the children.
without the children.
Yes.
But we might employ the Bayfield bells to maybe just cheat a little bit.
Yeah, a little bit of a distraction here or
Or
there.
stop them altogether from running. We'll do whatever we need to do, but
All is
in
fun.
all in good fun. All in good fun.
It's a great event and benefits the Cancer Center, of course.
Yes.
And people, all cancers, not just breast cancer, but
Right.
the pink is for the breast cancer.
Right. We want to, at PS, we have a Center for Cancer and Blood Disorders
Right.
for treating cancer at the Pagosa Springs Medical Center, and we want to save everybody.
And we
want-
are very grateful for the Archuleta County Fair people that
Yes.
are working on this so hard. They're just excited.
Right, and we have community parties going on where they're creating hats and bras. I just heard that there's going to be a bra stuffing party,
Oh, my
which
goodness.
to stuff it with money. That's what they said.
Oh,
Just-
perfect.
Great.
Just not,
Super fun.
Just super fun. And also creating baskets to be auctioned in the education building at the fair. So there's so much fun about this.
Come on out on August the 1st, a Friday night, to the Archuleta County Fairgrounds.
Yes, ma'am.
Yeah,
We'll
that
be
sounds
there.
very exciting, and definitely going to be some good competition with those first responders.
That'll be fun.
Yes, that's excellent. Is there anything else that you guys would like to bring up, or?
I think we're good. I think we've covered our bases. We're very grateful for being here today. Thank you so much.
Thank you, Jeremy. It's good to meet you.
It was
Nice
good to
to
meet
meet
you
you.
guys today too. It was an excellent conversation. I look forward to all the upgrades that you guys are bringing to the hospital.
Thank you.
Thank you. Well, have a good day, Pagosa, and we will see you next week.